So I am here with one of my favorite go-to people in natural health, Dr. George Kramer. Thank you for being with us today at the summit.
Thank you for asking me. I'm honored to be here with as part of the program.
Absolutely. Dr. Kramer has been a vital healing piece of the puzzle in my own, or our own family, which you'll get to hear about in just a little bit. And he is a medical doctor who specializes in natural pain relief. We were talking about this before the summit, that Dr. Kramer has patients that come from the 5-state area and even Canada to see him because he's literally one of the only practitioners in the state that does this, Prolozone and ozone injections. So what was really interesting for me to learn about Dr. Kramer was about ozone. And you mentioned that the injections actually stimulate the body's healing mechanism. So maybe if you could just answer that question a bit further. Tell us about ozone.
Yeah, ozone is 3 oxygen atoms. It's the smell that you hear after a rainstorm, or the smell you smell after a rainstorm that's fresh. That's ozone in the air, and it's 3 oxygen atoms. And how we use it in medicine is to hyperoxygenate deep tissue to increase blood flow and healing. We don't heal without oxygen. We don't live without oxygen, but our wounds won't heal if we don't have good blood flow. And Prolozone brings oxygen to that area along with nutrients to heal the deep tissue and stimulate connective tissue growth factors, stem cells, and fibroblasts, and then balance the inflammation, decrease the inflammation in the area so it decreases pain.
So it truly is, it's a healing modality.
Correct.
Yes, it is a pain relief modality, but even beyond that, I think what sets ozone apart from its counterpart, or not even in the same ballpark, cortisone, is that it is a healing modality. Dr. Kramer has been just an instrumental piece of our healing journey. This is my husband, Rob, and he has dealt with a low back injury that stems back to many years ago, and we've been maintaining it through chiropractic care and other things. But we reached a point this last year where the pain was excruciating despite all of our conventional interventions, and so we called Dr. Kramer. And Dr. Kramer, tell us what you found in Rob's spine.
Yeah. Well, Rob, he was hurting when I saw him. He could hardly straighten up. But his MRI, I want to show you, showed a large disc herniation at L5S1 level. Now, discs are like jelly donuts. They can crack, but if they crack enough, the jelly comes out and can bump a nerve. And his disc is quite large, and it was hitting a nerve and giving him leg pain.
I think it was actually in 2017 that I herniated my disc, so 2 years ago now.
To the point of needing a surgery to remedy it, likely.
Yeah. So I went in for an MRI, and basically it was fully herniated, needed surgery, no other option, and that's when Susie referred me, or Dr. Susie referred me to George, and we did the injections the first day, and there was no question. But before that, I couldn't walk. I had enough pain where I just about threw up multiple times a day, and as a dad of 3 little kids, 2 at the time, I couldn't get up off the couch, and so it was to a level that was, as Susie can attest, unbearable. And so when I went into Dr. Kramer, he explained all of it, said I'd be a perfect candidate for the injections, and after the first round, I went from probably level 10 pain to level 2 or 3. To the point, and I know it's not supposed to happen right away, but it did.
Sometimes it does.
And it was to a level that I could stand up and I could have a conversation with people. Couldn't exactly throw my kids, but I could be a human being again. And I asked him if I could come in a week later. And he said yes, and so I did. And at that point I went from level 3 to 0.
So Dr. Kramer, I just want to thank you again so much for your time, your talent, your heart, and all that you pour into your patients, like my hubby here. And we are just honored to have you here on the roundtable with us.
Yeah, thank you for asking me. I'm honored to be here.
Absolutely. Thank you.